So what are the latest trends that we're seeing at Riverbanks? Now we have Dr. Jain to tell us a little bit more. Dr. Jain, welcome.
Hello, thanks for having me.
First off, talking about skin boosters. Now, skin boosters, fillers, useful enhancements. Let's talk about what you do to improve the patient's appearance.
People are becoming more and more aware of the effects of Botox and dermal fillers, and they tend to be quite focused treatments. Botox addresses frown lines, for example, and fillers can address deep folds, okay, or loss of volume. But they tend to be quite focused treatments, and some people are naturally and understandably concerned that they don't want to look over-treated. Okay, they want to look like themselves. They want their skin to look fresher. They want their skin to look less tired, but they don't want to look like some freaks which they see, and often what they see on TV as well.
Exactly. I was going to refer to a particular show where those so-called bot jobs are on the agenda, and it is a horror story to watch. That's the other extreme, but you're at the other end of the scale.
Well, yeah, I mean, the most important thing, you know, and what I tried to get across the page, that we want you to keep looking like you, okay? But we want you to
Absolutely.
look your best, okay? And to do that, we will treat the causes that have, the causes behind some of the signs of sun damage that you've got, the loss of volume, the dehydration. Now, skin boosters in particular use hyaluronic acid, which is the main ingredient in most dermal fillers. It's the safest ingredient in most dermal fillers as well. So that's the key, safety. There's years and years and years of data and studies and treatments to reassure us all that these are safe products.
Yes,
Okay.
that was.
What's the difference between, you know, you've got your creams and then you've got this thing called skin boosters? I mean, could you say a good moisturiser skin booster, or is this something different?
Effectively, I mean, a good moisturiser will boost your skin, okay? Again, on a daily basis, okay? And what skin boosters are, we're injecting effectively moisture into your skin. We're using tiny, tiny, tiny needle pricks, very, very fine, okay? And we'll do the treatment, you probably have a syringe across the whole face, and these are tiny droplets of hyaluronic acid, which are very watery, and they go deep into the skin. And the job of them is what they do, they attract fluid, water to the area, tone up your skin. But what's recently been discovered is that they will also cause some collagen growth. So you'll get the stimulation of new skin growth with repeated treatments. Okay?
So is this like a typical result would be, you know, a woman going into the workplace and people would say, wow, you look great, rather than saying you've had work done? Is that something like a skin booster would do? It's
exactly,
like, yeah.
Exactly. You know, that is if someone says to me their friend guessed they'd had some work done, I failed. Okay.
Exactly.
Someone says to me
that
if someone says to me that, you know, people are saying I look well, I look fresh, then we know we've done what we said we were going to do.
Exactly. That you've had a good night's sleep look in your face.
Yeah. But skin boosters, it's typically a course of 3 treatments, and then you have one session every 6 to 9 months, depending on your skin.